In psychiatry, the terms sadism and masochism describe a personality type characterized by the individual deriving pleasure and gratification from either inflicting or receiving physical pain and/or humiliation, respectively. In some cases the pleasure and gratification may be sexual, but in others sexual pleasure is not experienced, and it may involve deriving the pleasure from masochistic or sadist behavior towards the opposite gender or same gender as self. Some individuals appear to be exclusively sadist and others exclusively masochistic in deriving their pleasure, but many alternately derive pleasure from sadist and masochistic thoughts and experiences involving themselves and others. The term sadomasochism denotes the co-occurrence of sadism and masochism in one person, as discrete mental disorders. Some contend masochism to be the spiritual inner self-punishment for acts inwardly acknowledged to be sadism. In psychiatric theory, the term sadomasochism may be used exclusively. The medical definitions, denotations, and connotations of sadism and masochism have been modified as required by medical progress, since the Austrian psychiatrist Richard Friedrich von Krafft-Ebing, 1840–1902, introduced the terms to psychiatry in the 19th century. This article presents the development of sadism and masochism as medical terms, leading to their contemporary definitions as a paraphilia in the Diagnostic and Statistical Manual of Mental Disorders, DSM. As erotic practices, the sadomasochistic subculture, and related matters, are noted historically. Early descriptions. Sadistic and masochistic sexual behaviors were known before Dr. Krafft-Ebing named them in psychiatry. The Italian Renaissance philosopher Giovanni Pico della Mirandola, 1463–1494, described a man who required flogging to achieve sexual arousal, and thus be able to copulate. In 1639, the German physician Johann Heinrich Meepham introduced the first theory of masochism and a treatise on the use of flogging in medicine and venery. Per the 17th century understanding of human anatomy, in fact the infliction of pain may simply have served to subdue very strong controls over active sexuality. Flogging a man's back warmed the semen in his kidneys, which sexually aroused him when it flowed into his testicles. 50 years later, in 1698, Christian Franz Paulini modified the sexual theory of flogging by substituting blood for semen as descending from the kidneys to the testicles in aiding sexual arousal. In 1788, François-Amédée Doppert expanded the theory of masochistic sexual arousal to include women, by presuming that flogging exercised a like effect upon the woman's genitalia and her consequent venery. Women can lose their degree of sexual arousal through some degrees of inflicted physical pain, while otherwise they may be tempted to use their sexual responses to physically reduce pain. Thus was the theoretic causal relation between flogging and human sexual arousal, until Krafft-Ebing's analysis and theorizing upon this aspect of human mental health. As a sexual practice, literature recorded sadomasochism before the works of the Marquis de Sade, 1740–1814, provided its name. In Asia, the Sexual Practices Manual Kama Sutra, c. 2nd century AD, describes consensual, erotic slapping. The British novel of sexual adventure Fanny Hill, Memoirs of a Woman of Pleasure, 1748, by John Cleland, presents an episode occurred in a brothel, wherein the heroine whips a young man to sexually arouse him. In the Autobiographic Confessions, 1782, the French philosopher Jean-Jacques Rousseau described his unhappiness for having masochistic fantasies. Some sadosexual practices may in fact stem from an instinctive wish to punish the object of sexual attraction for provoking sexual arousal as a perceived lack of respect. Even female animals can have this reaction. Relevant, discuss. Krafft-Ebing and the Psychopathia Sexualis. In 1886, Richard von Krafft-Ebing published the first edition of Psychopathia Sexualis, Sexual Psychopathy, a collection of sexual case histories and sex crimes. Later editions introduced the terms sadism and masochism. He derived sadism from his knowledge of the life and literature of the Marquis de Sade, before the posthumous publication of important portions of de Sade's literature, such as the 120 Days of Sodom, 1785. Masochism derives from the sexual practices described in the contemporary, 19th century, works, such as Venus in Furs, 1870, of the Austrian writer Leopold von Sacher-Masoch, 1836–1895. Furthermore, as so defined, sadism and masochism stem from different sexual and erotic logics, as do the denotations in the literatures of de Sade and Sacher-Masoch. Gilles Deleuze presented this distinction in his work about Sacher-Masoch. Krafft-Ebing's basic presumption was that recreational sexual intercourse was a perversion. The French physician Bénédicte Morel described sadistic and masochistic behaviors in a theory of degeneration, wherein preference for such sexual behaviors, for instance masturbation, was presented as an inheritable character trait that would lead to the deterioration of the human gene pool. Thereby, Krafft-Ebing perceived basic natural tendencies to sadism in men, and to masochism in women, a perspective later expanded by psychoanalysis. Nonetheless, Krafft-Ebing's contemporaries were skeptical of his findings and suggested modifications. The British physician Havelock Ellis, 1859–1939, noted that the enjoyment of pain was restricted to the erotic context. In 1892, Albert von Skrentznotzing introduced the Greek term algalagnia, algas plus lagnia, pain plus lust, as an alternative to masochism, in describing a person's enjoyment of the pleasure of pain. In the event, Sigmund Freud, 1856–1939, adopted Krafft-Ebing's theories to psychoanalysis, thereby ensuring their integral predominance in classifying and defining human sexual personalities. Freud and psychoanalysis. Sigmund Freud made masochism and sadism integral to psychoanalysis. Thus, in 3 essays on the theory of sexuality, 1905, he described the tendency to inflict and receive pain during sexual intercourse as the most common and important of all perversions, and that both psychosexual tendencies usually occur in the same person. That masochism is a form of sadism against the self, and that sadism and masochism are manifested variously as primary masochism and secondary masochism, and as the subordinate forms of feminine masochism and moral masochism. In the Freudian theory of psychosexual development, guilt is integral to sadistic and masochistic sexual tendencies, signaling either an incomplete or an incorrect sexual development of the child. In the event, Freud's successors, Carl Jung, Wilhelm Reich, and Theodor Reich, modified and developed his ideas with new terms and supporting concepts. Ellsworth Baker attributed the origin of masochistic character to parental inconsistency. Helen Deutsch postulated that women are naturally of masochistic character, reinforcing the theories of Krafft-Ebing and Freud. The Freudian theory of sadomasochism and the philosophy of the Marquis de Sade were developed by intellectuals such as Simone de Beauvoir and Gilles Deleuze, whose writings influenced the popular mainstream perception of sadism, masochism, and sadomasochism in the mid-20th century. Empirical research. Beyond psychoanalysis, the study of practicing sadomasochists changed societal perceptions of sadomasochism in the late 20th century. And Sexual Behaviour in the Human Male, 1948, and Sexual Behaviour in the Human Female, 1953, the sexologist Alfred Kinsey reported the sadomasochistic tendencies of men and women in the U.S. Moreover, in 1972, Robert Littman was the first sexual behavior researcher to describe the extant sadomasochistic subculture of the U.S. in 1977, using questionnaires to obtain the elementary data. The German psychiatrist Andreas Spengler conducted the first large-scale empirical study of sadomasochism. The results reported in Sadomasochist and Undivided Subculture and Sadomasochists and Their Subcultures, 1979, contradicted most of the earlier work about sadomasochism, especially that of the psychoanalysts, from which Spengler concluded that the previous research was heavily burdened with prejudice and ignorance. When the statistician and medical researcher Norman Breslow expanded upon Spengler's work, he discovered the existence of only 5 previous empirical studies of sadomasochism in the scientific literature, which included Spengler's study. Furthermore, Breslow was the first researcher to show that normal women, who are not prostitutes, were a great proportion of the sadomasochistic sexual subculture of a society. None of the extant studies presented causal links between sadomasochistic tendencies and violence, violent crime, or sociopathic behavior that were presumed, since the time of Krafft-Ebing, in the 19th century. The acceptance of sadomasochism without cultural norms can further psychopathic or fake psychopathic crime of a type which fails to be prosecuted or charged. The understanding that many more people practice sadomasochism than was previously believed, and the existence of sadomasochistic sexual subcultures, prompted the investigations of non-medical researchers. The American sexologist and anthropologist Paul Gebhard described the cultural contexts of sadism and masochism. The German Thomas Wettstein conducted a large-scale sociologic study of the local sadomasochistic subculture that confirmed and expanded upon the results of the Spengler study, Sadomasochist and Undivided Subculture, in 1979. The investigations revealed that sadomasochistic women practice the sexually dominant sadistic role and the sexually submissive masochist role in equal measures. Yet sadomasochistic women may also be in fact the few committed moralists and monogamists committed to chastity. Much modern sexual research of sadomasochism describes the psychologic characteristics and dynamics of the tendencies, rather than seeking to establish their psychic origins. Contemporary perspective. The results of the studies, and increased societal toleration of sexual minorities led to sadomasochists organizing in groups such as the Yule and Spiegel Society in 1971 in the US. This is especially true in countries where consensual adult sadomasochism is legal, such as in Germany and Norway. Resultantly, sadomasochism entered the mainstream cultures of the West and of Japan, via the works of Marie Marcus in Denmark, Patrick Califia in the US, Vanessa Dorius in France, and Catherine Passig in Germany. The reportage of the new studies allowed the elimination of sadism and masochism as categories of sexual and mental illness. The latter may be, to adjust standards to the new exigencies of anti-extremism, to law enforcement's liberties in the field of body searching all suspects irrespective, and to adjust the real standards of non-Christian nations across all continents. Moreover, the BDSM subculture presented social and legal discrimination as further reasons to eliminate said mental illness categories, by noting the precedent of homosexuality having been eliminated from the list of sexual and mental disorders. In 1994, the American Psychiatric Association responded, by modifying the denotative criteria defining sadism and masochism in the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-4. Thus, consensual sadomasochistic behavior no longer is considered a sexual disorder. Furthermore, in the textual revision of the DSM-4 TR, 2000, sadomasochistic behavior is a sexual and mental disorder, if the patient has acted on these urges with a non-consenting person, and if the urges, sexual fantasies, or behaviors cause marked distress or interpersonal difficulty. Elsewhere, in 1995, Denmark became the first country to delete sadomasochism from its medical disorders system of classification.